Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome to the Coaching Healthcare Leaders podcast. So I am your host, Dr. Lisa. I am a board-certified family physician. I am also an executive leadership coach and host of this amazing series that we're having today. So my first guest for today is Dr. Mary Fleming. So welcome, Dr. Fleming, to the podcast.
Hello, thank you so much.
So I'm going to give a little background about Dr. Fleming, and then we're going to get into some questions and find out all about her amazing journey. So Dr. Fleming is an obstetrician and gynecologist. She is also the president of the nonprofit Reede Scholars, where she fulfills her purpose as a health equity advocate for vulnerable and marginalized populations. In addition to this work, she has also strengthened her practice by serving as a medical legal consultant and a physician editor, which requires continuous review of the current medical literature. In 2021, she became the director of the Leadership Development to Advance Equity in Healthcare program in the Executive and Continuing Professional Education Department at Harvard T.H. School of Public Health. She continues to explore avenues to grow her skill set, serving the vulnerable populations of the country and also globally. So, welcome again. I can't wait to learn more about your leadership journey.
Well, thank you. I'm happy to be here, and I'm always happy to share my kind of alternative pathway, if you will.
Yes.
I think there's lots of different ways to do things, and so always happy to share.
Yeah. Thank you. So, the first question I have for you is just that. If you would just share your leadership journey with us, tell us a little bit about how you arrived at the place where you are now, and then who or what may have been instrumental, in that journey.
I mean, I think it's always like, well, you want the long story, or the short story, but I think I really started thinking about leadership, um, not knowing what it was necessarily, but as watching my grandparents lead. My maternal grandmother was always on somebody's committee, the usher board committee, the neighborhood watch committee, and just watching how she step up and fill in the gaps, things arose. Always kind of putting in a little bit of an extra, if you will, and always making sure we made time to give back. And so she was very adamant about volunteerism and outreach, doing community service. And so I learned that from her. My grandfather, my paternal grandfather, was actually one of the first three Black men to integrate to the University of Louisville Law School. And so thinking about what it took to do that at that time in the 1950s, actually a little bit ahead of the curve, and how he continued to be a leader in our community as a whole. He and my dad and that side of the family grew up in a small town outside of Louisville. And so um, it was really instrumental in how through the local community, but also with the big community leader in Louisville as well in a whole nother city. And so I think that's where I understood that life is about more than yourself. And when you can find a way to impact other people. And so when I was in high school, I started looking for, usually I say I'm a person who likes to help out. So I like to fill in the gaps. What are things that I think I can do well that would be, and started looking for opportunities there, and then continue that through high school, college, medical school. Kind of revved up in medical school because I was really interested in the National Medical Association. So ended up being president of that and some other, um, involved in some other community activities, and communities on the undergrad campus as well. And then, of course, culminating to be chief resident as a OBGYN resident and very much in Nashville. So it's been an evolution. So I think it's always been a part of my journey that's just evolved into what the roles were really dependent on what my that immediate community needed at the time. And so I was really interested though after residency and trying to figure out again, always trying to understand what this world looks like that's bigger than our one-on-one interactions with patients, which is important. You got to do that part. But especially growing up, the neighborhood I grew up in Louisville, going to um, two HBCUs and spending a lot of time in Nashville and understanding the difference between how people receive care at Vanderbilt and how people receive care. Very thinking about the other dynamics that go into play besides the local healthcare system and how state and city policies also affect healthcare and hospitals and reimbursement. We can go on and on and on. And that's what led me to do the Commonwealth Fund Fellowship in Minority Health Policy. That was a 1 year fellowship specifically for physicians and dentists interested in health equity, and that's where I received my MPH. Um, Left there to do some clinical work. I wanted to be sound in my clinical practice and get my board certification and that and all of that. So I went to um, Montgomery Hospital in Norristown, Pennsylvania. Spent 4 years there, and then transitioned into the traveling, which is the most part of my journey now. In 2015. So I can pause there because that was a lot. I don't know. I want to keep going, but we could dive into some other things.
Yeah, yeah. So I think it's interesting that, you were actually exposed to what it really means to be a leader, starting out, it sounds like, in childhood, just sort of watching your members of your family take on those roles in their communities and serving as, back then, what we would consider, advocates for the community and also leaders as well.
Absolutely.
Yeah. So the family dynamics are really, really important. And I can definitely see how that shaped you into, the leader that you are today. So tell us a little bit about in the current work that you're doing, in your current role, what does that look like? What does a day in the life look like for you? Who do you serve and what challenges may you be facing?
Absolutely. So, I would say in short, one day of mine does not look like another. I may be in a few weeks ago, I was in 5 different cities in 10 days. So move around a lot. But as I was saying, when I transitioned into 2015 to start doing locums work, I really wanted the opportunity to one, travel, personally and professionally. I wanted the opportunity to see how medicine was practiced in different environments. So working in rural America, suburban America, kind of what I call middle USA, which is kind of neither of those. It also allowed me to do some global work, and I went to for Kenya to 6 months. And so I really wanted to round out my personal practice of medicine to really get a more broad understanding on how people interact with the system, where the gaps are, how I can be useful. And so that evolved into I was also growing Reed Scholars at the time. I became president in 2014, and so we were still a relatively small fellowship program, so we're still a relatively small cohort. And so in growing that organization and seeing how we can be a resource to people who are trying to figure out this health situation in their own neck of the woods. And then the opportunity, as you mentioned, to develop the leadership development health leadership development to advance healthcare equity in healthcare evolved. And it was really an exciting opportunity for me to be able to share with people who can then share with people who can then share. Because I feel like that's really how you um, exponentialize information and change. And uh, so a day for me could look like I could be in the hospital for 24 hours doing clinical work. Right now, my clinical assignments are in Pennsylvania and Kentucky. I could be podcasting. So Reed Scholars also has a podcast. So sometimes I'm the host. It could be going to meetings. I was recently founder, former chief medical officer of a startup, which was a very dynamic and interesting um, learning experience, I will say. But that was managing people, which is something I hadn't done a lot before. that was interacting with investors and venture capitalists, that was, trying to build a program from scratch and interfacing with our partners in the payer system and the healthcare system. And there's a lot of facilitating meetings and connections and kind of growth opportunities. And so some of that required travel, and then some of it was virtual. And then I like to sprinkle in my own personal travel as well. And so it's really important to me, one, do things that fill my cup, but also be able to show up for my family and friends when they have events or activities or just, they come home.
Yeah. Well, it sounds like you have a lot on your plate, but it also sounds like your work is very inspiring and motivating. It fills your cup, but also allows you the flexibility, like you said, to be there, for your family and friends for those special moments.
Yeah, I always say that's how that's my first priority is flexibility when I'm thinking about taking on a new assignment or taking on new work. Flexibility has to be priority list.
Yeah. Yeah, that's wonderful. So tell us a little bit about how, the current work that you're doing right now impacts communities or impacts patients. We know that health equity is broad. There are a lot of things that fall under that. Maternal mortality is of a huge public concern, in the United States these days, with that rate actually being higher, obviously, in certain communities, especially like in Black and brown communities, maternal mortality rate is even higher, 3 times that, as a general population. So, tell us a little bit about how the work that you do, may serve a particular community or communities or patients.
And so, I think when we think about impact and change, it has to be at every level. So we still need to have competent physicians who are well trained, that are providing excellent bedside care, who are aware that health disparities are exist, and so that you can have um, informed and we'll say graceful interactions with uh, potentially very high risk patients in different. My clinical assignment in Louisville is a very busy, high risk population, so I get to put those clinical skills to the test every time I work there. I just started in Pennsylvania, and I've worked in a lot of rural Pennsylvania, so there's some other rural areas. But thinking about how people interact in the healthcare system in rural areas is different when you think about access to transportation, um, because there might be such geographical gap in resources and locations, and thinking about how to navigate those and being able to be sometimes more creative in your recommendations, knowing that, you know, even thinking for maternity care that people may not be able to come every 2 days for an NST, which is part of our high risk protocols. But if you live 2 hours away, we have to think about things. There's also a large Amish patient population where I'm working, which very different in how they interact with the healthcare system. And so just being understanding and being, having that cultural humility to allow people to interact the best way for them is something that I think that I do well. But also just being there and having that influence on other people who are working in those practice environments. And I intermittently get to work in a training environment. So right now, it's also a residency program there. So part of
Hmm.
the teaching environment and kind of sharing my journey with them. And then, as I mentioned, the Reed Scholars, we do some podcasting. So, one of my goals is to make health equity an everyday conversation, because it's what it has to be for us to make change, right? And so, health equity happens where we eat, work, play, and pray. And so we have to start having these conversations and approaches to where at PTA board meetings, right? When we really think about, you know, where our house physically is affects our health, and everything around our transportations, our roads, our grocery stores, our education system, and access to the closest hospital. And all of those things have to be part of our everyday conversation. And it's not just for positions. It's not just for policymakers, right? It has to be part of the everyday conversation. So I hope that's kind of what we do on a slightly broader community scale. But also, we host an annual health equity symposium every year to try to think about innovative solutions. So I'm one that doesn't really just want to, do all statistics on health disparities. They exist. We know it. It's not new. So what are we going to do about it? How can we work? How can we every time I have a conversation with somebody, I hope you can figure out something you can go back to your community, do as an individual, and also what can you take to your broader community to make a change, right? Over time.
Mhm.
And then last we talked a little bit about the leadership program for health equity, and that program is built for healthcare leaders more broadly. And so, it's not just those who are in clinical medicine, but also those who are working for healthcare systems, payer systems, some of the commercial healthcare platforms as well. And so, again, trying just to move the conversation out of the clinical niches, if you will, into broader spaces so that we can have communication and broader policy making at every level. And that's what we really need to do. Be impactful and long lasting.
Yeah. Yeah. And I love that. That's great work. Like you said, we can spew statistics all day, but what are we actually going to do to move the needle, right? To make change. So that kind of leads me into my next question. Seeing that we do have these challenges in healthcare, what are some suggestions maybe that you have of how we can make a change or maybe deliver care differently to make an impact?
I mean, anytime you have um, an opportunity to learn more about anything that interests you. I also tell people, like you said at the beginning, health equity is a huge breadth of information and issues and ways to interact with it. And you don't have to do them all at one time. You don't have to try to, tackle transportation access and, the built environment and educational policy, right? Like we all don't have to do all the things, but if you can do something, that's great. So think about something that either is directly impactful for you on a day-to-day basis. So if you notice your grocery store is 4 miles away, um, what is your local city government doing about that? How are they addressing food deserts? How are they can you start a food market or a community garden, right? If that's what interests you, right? If you have school-age children, I mean, educational policy, right? How our children, where our children are educated, is going to impact their lives, for the rest of their lives. So, think about being on a school board or a PTA, if that's what interests you. Um, Anything that is already interesting to you, figure out what people are doing on the local level. If you're interested in urban planning and zoning, a lot of how neighborhoods shift is based on changes in city zoning. And so going to those are open meetings. You can go and see what people are talking about and how they're moving lines or who's trying to come into the neighborhood and who's trying to build what where thinking about if you're interested in climate change or environmental pollutants, a huge deal for a lot of neighborhoods. And so see who's having those conversations, where those are. And then as you build into that, where can you, again, fill in the gaps and share your personal expertise and leadership. And like I said, and we need people at every level. So we need people who are on the ground root, city level. But we also need people in state.
Yeah. I love that. I mean, you had me thinking already about some things that I can do in my own community. So, I like the way you really broke that down and made it achievable, like little bite size, right? Things and areas that we can impact that we don't have to think about it as such a huge project to take on all at once. So thank you for sharing that.
Of course, of course.
Yeah. So, as we wrap up, you mentioned all the things that you're doing, which I find to be so fascinating, but also I know it's a lot, sometimes to carry. And sometimes as leaders, we do that. We get ourselves involved in things that we're very passionate about, that where we feel we can make an impact. But then sometimes it may also, leave us a little depleted. So, what tips can you give our listeners about, how to survive in the face of adversity, challenges, or just overwhelm, but still be able to make an impact, and also care for yourself?
I think constant reevaluation is important. I was given a talk yesterday in one of the students, she was like, "I feel like I'm putting out 10 fires every day, right? You're just constantly running." And so just like we check on others, we have to stop and check on ourselves. Like, are we what is what we're doing right now, serving me? It's like, is what I'm doing serving me in this moment? And if it's not, it serve me in the future. And if it's not, then that might be something I need to take off my plate. And so I try to do that often. I have friends who also serve as accountability partners, and so we try to do that for ourselves, that constant check in and see what all the things that we have on our plate. Is there anything that needs to be paused or taken off altogether?
Mhm.
And then also, like, what do you do that makes you feel better, that lifts your spirits, or just reconnects you or grounds you into the world? And so for me, it's travel, friends, and family. And so I tell people that I start my calendar with those 3 things. Where do I wanna go? Where do I wanna be? Where are my friends, asking me to be? And where does my family ask me to be or need me to be? And that's where I start, so that I know if I'm always showing up for them, everything else will work. And so that's kinda how I start. But I do self-care things too. I mean, I think therapy is important. I've used an executive coach most recently, so I think as you're going through transitions, it's sometimes helpful to have an independent sounding board. I think I did a no travel January where I because I move around so much, so that I just kind of focused on, eating well and trying to do a little exercise and just kind of being still and refocusing. But then the next month I went to Costa Rica with my friends. So, you know, it's and I think balance. Some people say balance is an fallacy. I think balance is an evolution that you have to move as you go to balance that you need at that time. And so what I needed in January is not the same thing that I need in May. It's okay. And so I think that check-in is what's really important.
Yeah, absolutely. Absolutely. That's wonderful. Well, thank you for sharing those tips. I'm sure they're going to be helpful to anyone who's listening. Yeah, and I'm excited to see, all the things that you have going on. Well, thank you so much. This has been an engaging conversation. I learned so much about you and the work that you're doing. Although I do follow you on LinkedIn, I think that I was able to get more insight into some of the work that you're doing. So kudos to you. Continue the great work that you're doing. And I look forward to connecting with you even more. Thank you.